Are you turning 65 soon? Or maybe you're past 65 and already on Medicare. Which Medicare supplement is best for you? Not your spouse, not your friend, not your neighbor, and certainly not an insurance agent. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. If today is your birthday, then happy birthday to you. Anonymous, the famous Greek philosopher, said, "The more you praise and celebrate your life, the more there is in life to celebrate." I hope nobody believes me that I think Anonymous is a Greek philosopher. So what is a Medicare supplement plan? Let's take a look. They are also known as Medigap plans. So they supplement or fill the gap of what original Medicare doesn't pay. And they have been around since 1966, shortly after original Medicare was started. And Medicare is the primary payer. So the supplement is secondary. Medicare pays first. The supplement pays second. And typically Medicare supplements are accepted wherever original Medicare is accepted, and 97% plus or minus providers accept Medicare assignment. There are no provider networks unless you pick a select plan, which I advise you don't. Watch my video on the Medicare supplement select plans that I tell you to avoid. That will give you more information on those plans. Medicare supplements have less prior authorizations and benefit denials compared to Medicare Advantage. So what are the Medicare supplement plans available? There are about 10 to 12 different plans available. That is contingent upon your age. They have phased out what is the Plan C and the Plan F's, the F and the high deductible F, starting in January 1st of 2020 for those that are turning 65 after that. So the plans are A, B, C, D, F, F asterisk, which is high deductible, G, the high deductible G, K, L, M, and N. And again, the C and F plans are no longer available for people turning 65, and these would be different in places like Massachusetts, Minnesota, and Wisconsin, which have different supplement plans. So which Medicare supplement plans should you consider? To me, it really comes down to three: the G, the N, and maybe for the very unique person, the high deductible G. The G plan is the most comprehensive plan available for people turning 65 since January 1st, 2020. You pay the Part B deductible, and that is it. And plan on about a 10% plus or minus rate increase per year. Typically tell people, again, if you have a Medicare supplement, the rate's going to go up 2 to 10% a year. Don't be surprised if you have a year where it's 15%, maybe even higher sometimes. But on average, especially for a Plan G, you probably want to consider about a 10% rate increase every single year. Hope for less, but plan on about 10%. The Plan G is ideal and best for someone with health issues or chronic conditions that cause them to frequent medical providers, and someone that doesn't care about paying more to not have to deal with any potential copayment. Then we come to the Plan N, and you can watch my video on me doing a comparison between the Plan G and the Plan N to get a real good breakdown on that, and I suggest if you're looking at that you do watch that video. So the Plan N is very similar to the G. You're going to pay the Part B deductible as well, and then you're going to have a copayment of up to $20 for some office visits. Again, could be from a penny to $20, and the ER of up to $50, and unless they admit you from the ER to the hospital, then you don't pay the ER copayment. And then the Plan N does have where you'll be responsible for paying the excess charges. So these are incurred at a provider that doesn't accept Medicare assignment. Again, 97% plus or minus accepted, but if you went to a provider that did not take Medicare assignment, they can charge you 15% above the Medicare approved amount. Again, see my video on comparing the Plan G to the Plan N about that. And some states do not allow that charge to be incurred. Also, for the Plan N, you want to plan on about a 7.5% plus or minus premium increase per year. Could be lower, but also could be higher. So it goes up less than the Plan G. So over time, the premium savings between a G and an N gets greater and greater. It is ideal and best for someone that is relatively healthy and doesn't frequent medical providers more than a handful of times per year, and someone that doesn't mind the potential for some minor co-payments and wants to save thousands of dollars over a 10 to 15 year period. Then we come to the high deductible Plan G. So this is a supplement that kicks in when your share has exceeded the deductible limit. Currently in 2023, that is $2,700 per year. I call this a catastrophic supplement. The deductible does go up every year based upon the Consumer Price Index U is for urban. So this is kind of the issue. Historically, it hasn't increased a lot. Historical average is about 2.4% per year, but over the last 2 years, it's increased at an average of 6.35%. So if inflation continues to run high, then that deductible is going to go up rapidly. Let's take a look at what could happen. Based on historical averages, in 10 years, the deductible could be at $3,500, and in 20 years, it could be at $4,500. That still may not be too bad compared to whatever options are available at that time. So plan on, for a high deductible G, about a 2% plus or minus premium increase per year. And again, of course, no guarantee. It could be higher. The high deductible plan G is ideal and best for someone that is very, very healthy. They work at maintaining their health, meaning they exercise regularly. They eat very well. They don't have any bad habits, so to speak. They hope to stay in good health, and they won't have an issue coming up with the deductible if the need arises. They want to save thousands in premium dollars over time and maybe reallocate that money into something else like a long-term care policy, an investment, savings, or paying down debt. Very important. Realize that several years with a health issue and frequent provider visits will seriously cut into your potential savings should you consider a Medicare Advantage. I'm not like a lot of agents that totally frown upon Medicare Advantage. I have found over 13 years dealing with thousands of people that Medicare Advantage does work well for many, many people. I would say probably even the majority of people. It's not perfect. You need to understand how it works, but it might be something that you want to consider, and we can have an honest, open conversation about it. So when it comes to Medicare Advantage, you want to make sure that there are good plan options available in your area, that you get good prescription coverage. You go with a plan or a company that has a large, stable, nationwide network. Try to find the lowest, what we call MOOP, the maximum out of pocket every year. It would come with the extra benefits, and most importantly, understand how the plan works, that you will probably have some copayments. In some areas, they could be very low. Some areas, they could be very high. You need to understand how they work. And you need to understand how they work dealing with prior authorizations and potentially benefit denials. So what's next? Typically, it comes down for most people between the Plan G and the Plan N. Again, very few people is the high deductible G a good fit for. So contact me if you live in one of the states that I'm licensed in to discuss rate comparisons and options to maximize your premium dollars and premium savings. If you are turning 65, you will likely need and want a Part D drug plan as well, and I can help with that too. I will review your medications and use the Medicare prescription calculator to determine what Medicare says is the lowest overall cost Part D plan for you, based upon your unique medications and pharmacy choice. If I represent the lowest overall plan, then I will enroll you into that plan. If not, and there is one significantly cheaper, then I will tell you which plan that is and how to contact them. If you have questions, if you need help, you see my contact information there, please reach out to me. You can go to my website and you can see there's a couple contact pages on there. You can fill out that information and reach out to me, and I will get back to you. The states that I am currently licensed in: Virginia, Florida, Georgia, North Carolina, Ohio, South Carolina, Tennessee, and Texas, with more states coming soon. And here's where you can help me out. Please, in the comment section below, let me know what state that you are watching from so I can see if there's people watching from a lot from one particular state, then I would consider getting licensed in that state as well. If you live within an hour to an hour and a half or so of the Charlottesville, Virginia area, and you would like to meet in person at a safe and convenient location, then please reach out to me and we can probably arrange that. I want to remind you again to please like, subscribe, and who do you know that could benefit from this video? Please share it with them. So that's it for today. If you're turning 65, which supplement should you choose? I hope this is helpful. Consider the G, the N, and maybe the high deductible G. I'm Chris Brang, the Medicare analyst. Make it a great day.